In this video, we will be discussing about dermatitis. You all may be knowing that dermatitis, it is a common skin condition. Okay, it is an inflammation of the skin that is characterized with redness, itching. Okay, so we will see in detail about dermatitis, signs and symptoms of dermatitis, and the types of dermatitis that is important for BSc nursing students. So, dermatitis is also known as eczema. It is a chronic pruritic inflammatory disorder affecting the epidermis and dermis. Okay, it is a chronic pruritic inflammatory disorder means it can cause severe itching, okay, and irritation. Okay, and it affects the epidermis and dermis. We know that the skin is having three layers: epidermis, dermis, hypodermis. Okay, so these particular dermatitis affect the epidermis and dermis, and it will be starting in infancy, and it can persist throughout childhood, and even it can reoccur during the adulthood. Okay, so they are non-infectious inflammation of the skin, and it can be acute, subacute, and chronic. Okay, these are the clinical stages. Okay, acute, subacute, and chronic. There will be some of the signs and symptoms will be seen in each stages of dermatitis. See the image. This is acute dermatitis. Now we'll see signs and symptoms. We have seen that it is an infection that occurs in acute stage, subacute stage, and chronic stage. So we'll see what are the signs and symptoms experienced by the patient during each stage. Okay. So in acute stage, eczema shows redness, swelling, papules, blisters, oozing, and crust. Okay. So what is papules? Papules means like pimples. It will be. There will be like a swelling will be there. Okay, and blisters will be there, small blisters we can see, and oozing and crust. Okay, that is oozing means there will be fluid filled blisters. Okay, so all these signs and symptoms we can see in acute stage. Okay, so in the subacute stage, that is in the second stage, the skin is still red but becomes drier and scalier and may show some of the pigment change. So scaling means loss of upper layer of the skin. The layer of the skin will be peeled out. Okay, so that we'll call this scalier appearance. So in the subacute stage, we can see dryness and scalier. Okay, and in the chronic stage, that is in the final stage, we can see lichenification, excoriation, scaling, and cracks. Lichenification means thickening of the skin. Okay, the layer of the skin will look thickened. Okay, and excoriation means wearing of the skin. The skin will be wear down. Okay, so for that we'll call it as excoriation, and scaling and cracks are seen. So cracks means like the layer of the skin will be dry and thick, especially these cracks we can see on the heels. Okay, the major area, okay, of the heels we can see some of the cracks. The particular area of the skin will be very dry and thickened. These are the signs and symptoms of dermatitis. And we'll see the types of dermatitis. There are 4 types of dermatitis: atopic dermatitis, seborrheic dermatitis, infective dermatitis, and contact dermatitis. Okay, so atopic dermatitis or atopic eczema means it is a chronic relapsing skin disorder that usually occurs in infancy with clinical features of dry skin and pruritus. Okay, in atopic eczema or atopic dermatitis, we can see dry skin and pruritus. Okay, and there will be the lichenification will be there because of constant rubbing and scratching of the skin. And some of the genetic predisposing factors also can contribute to this type of eczema because of the IgE immunoglobulins and all. Okay, so the triggering factors that causes this atopic eczema is dryness of the skin, certain infections, sweating, some of the allergic agents, even stress. Okay, all these contributes to atopic eczema. So atopic eczema means the skin disorder that is chronic and which reoccurs. Okay, so the clinical features are dry skin and pruritus, which leads to lichenification of the skin. And the some of the triggering factors are dryness, infection, sweating, and irritants. Okay, so the most affected site of this atopic dermatitis are elbows, knee folds, wrist, ankles, face and neck, and in some time we can see it as generalized all over the body. Okay, this is the picture for atopic dermatitis. See. Okay, so next we will see go for seborrheic eczema or seborrheic dermatitis. Okay, seborrheic dermatitis means it's a very common dermatitis with redness and scaling of the skin. And the main feature of seborrheic eczema is it is found in the area where sebaceous glands are most active. Okay, so we know that sebaceous gland produce sebum. Okay, this sebum is very essential to retain moisture for the skin. Okay, so wherever the area we can see sebaceous gland, seborrheic eczema can occur, especially in scalp, behind the ears, in nasolabial fold. Nasolabial folds means the areas on the both side of the nose, okay, and near to the corner of the mouth. Okay, so there we can see the nasolabial fold in the sternum, in the groin region, perianal region, axilla, under the breast, umbilicus. Okay, and in body folds we can see seborrheic eczema, and the patient will be coming with chief complaints of oily skin always. Okay, this eczema is also recurrently it can occur, and for HIV patients, seborrheic eczema can lead to other super infection. Okay, so seborrheic eczema occurs in the regions where sebaceous glands are most active. Okay, so next we'll see infective eczema. So infective eczema occurs as a response to oozing skin infection. So oozing skin infection means there will be fluid filled blisters. Okay, so where there is it occurs as a response to this fluids filled skin infection. Okay, the common site are foot and ankle region, and as it is infective, the most causative organism are Staphylococcus and Streptococcus, and Vaseline can aggravate this condition as it is an oozing skin infection. Then we'll see about the contact eczema. It is caused by the contact of the skin with some of the irritant or an allergen. Okay, some of the allergens like already we have seen what are the allergens, what are triggering factors that causes dermatitis. So here in contact dermatitis, the main irritants are excessive use of soap, detergents, chemicals, okay, jewelry dyes, bleachers, perfumes, nail polish. So in all these contents, we can find some of the fragrance. Okay, some of the like chemicals will be added. So all these can contribute to contact eczema, and Vaseline also commonly causes Vaseline dermatitis. Okay, so this is the picture of contact dermatitis. The main signs and symptoms of dermatitis is itching, redness, lichenification, excoriation, papules, blisters, oozing and crust, and color changes because of the pigmentation. These are the general signs and symptoms of eczema. And we'll see the some of the management of dermatitis. Okay, so in bacterial infection, we can use potassium permanganate solution, betadine solution, antibiotic. Especially we know that some of the dermatitis like infected dermatitis are caused by staphylococcus and streptococcal agent. Okay, so we use like antibiotic treatment will be given, and we have to tell the patient, we have to explain to the patient the disease condition, and we have to make the patient calm. Okay, and we have to explain the pathological changes that happens during disease process. And for preventing scratching and spreading of the infection, we have to tell the patient to keep the fingernail short and covered at night. Okay, and for seborrheic eczema, we can tell as it is the like areas eczema occurs where the areas where sebum is produced. So we have to tell the patient to use non-greasy and or non-moisturizers. I hope you have understood. So today we have discussed about the like dermatitis, signs and symptoms, and mainly the types of dermatitis. Okay, atopic dermatitis, seborrheic dermatitis, infective dermatitis, and contact dermatitis. Okay, so hope you have understood, and this is very important topic.